Hello, my name is Holton Fox. I'm a third-year medical student on the Cherokee Nation campus. And Drew Williams and I, and along with Dr. Hartwell, worked together on this research topic titled Association of COVID-19 Diagnosis and Depression in Healthcare Workers. And throughout our research, we found that depression has been on the rise in the United States prior to and throughout the COVID-19 pandemic, with the percentage of U.S. adults with depression significantly increasing from 8.7% in 2017-2018 to 10.6% in March of 2020, and then lastly 14.4% in April of 2020. So this shows us that the COVID-19 pandemic has had a profound impact on the mental health of the U.S. population. And we know that throughout the pandemic, healthcare workers experienced numerous occupational stressors and experiences such as increased workload, physical exhaustion due to increased patient load, limited availability of PPE, and then also negative interactions between colleagues and staff. And we found that individuals who acquired COVID-19 have shown higher rates of emotional distress, anxiety, depression, and were more likely to acquire a new psychiatric illness. So determining an association between a COVID-19 diagnosis and depression in healthcare workers, this may bring awareness to potential improvement strategies for the mental health of providers with potential to improve patient outcomes in the future. Because we know that if a healthcare provider is suffering from a psychiatric illness, this can ultimately affect their patient care. And so the aim of our study was to determine the association between a diagnosis of COVID-19 and the potential increased risk for depression in healthcare workers. So for our methods, our data was obtained from the 2021 National Health Interview Survey, which is conducted by the CDC. We used a design-based chi-square test to determine the association between a diagnosis of COVID-19 and then depression severity among healthcare workers. And lastly, we used a logistic regression to assess the likelihood of reporting a diagnosis of depression by COVID-19 severity. And if you look at the middle of our poster here in our results section, you can see out of the 2,287 healthcare respondents, 20.81% reported a diagnosis of COVID-19 and 19.83% reported a diagnosis of depression. And of the participants who reported a diagnosis of depression, there was a significant difference in the rates of those with a positive COVID-19 infection. And among those healthcare workers with depression, 66.67% reported having moderate or severe symptoms, and 31.33% having no to mild symptoms. And of those medical workers who reported being diagnosed with COVID-19, we found that compared to those with mild or no symptoms, individuals with moderate to severe symptoms were more likely to have reported having a depression diagnosis when adjusting for comorbidities of diabetes, coronary heart disease, and sex. And so what can we conclude from this study? We can conclude that the rates of depression diagnoses were higher among healthcare workers diagnosed with COVID-19, as well as those who had more severe COVID-19 symptoms when compared to healthcare workers with mild to no symptoms. And among the healthcare workers who are caring for and treating those diagnosed with COVID-19, mental health screening may need to be done earlier due to the increased risk of exposure among these individuals. And in the future, we would like to see interventions focused on improving mental health screening and then the rates of mental health counseling, which this could potentially mediate the mental health burden among healthcare professionals. And we hope that future studies could show how implementation of further mental health screening and counseling could impact the overall mental well-being of healthcare workers and subsequently patient care. And that is all that I have. Thank you all for your time.